The backside of your knee is a complex region where many anatomic structures cross each other. It is therefore not always easy to pinpoint the exact problem when it hurts. However, if you are able to locate the pain exactly and how it irradiates, it is often possible to come to the correct diagnosis and to decide on the appropriate treatment plan. In this video, I will present the 10 most common conditions, which cover about 98% of all potential reasons for pain in the back of the knee. And I will also explain how the diagnosis can be confirmed and what the treatment options are. Number 1. Baker cyst. A Baker cyst is a swelling in the backside of the knee that is caused by joint fluid that has leaked out of the joint and which has become encapsulated. Usually the cyst is located somewhat medial to the center. When the cyst is small or moderate in size, there usually is very little or even no discomfort. But when the cyst is big, it will cause tension or a feeling of tightness in the back of the knee, sometimes irradiating up and down the leg. The diagnosis is easily made with an ultrasound or an MRI scan. The treatment is relatively straightforward. For a small or medium-sized Baker cyst, no treatment is needed because they usually don't lead to symptoms, except occasionally some minor discomfort in the backside of the knee. So in those cases, you can disregard the presence of the cyst and you don't have to do anything about it. For a larger cyst, the underlying cause for the fluid overproduction needs to be stopped so that the cyst can shrink and disappear. This can either be done with physiotherapy and anti-inflammatory medication, injection therapy, or arthroscopic keyhole surgery. Just needle aspiration and draining of the cyst will usually not help, because the cyst will come back very rapidly if the cause is not treated, sometimes even already the next day. So the underlying cause for the cyst always needs to be treated, otherwise the cyst will come back. If you want to know more about this, please have a look at this video. 2. Semimembranosus cyst. Before you decide that the problem is a Baker cyst, be sure that it is not a semimembranosus cyst, because the two are completely different. A semimembranosus cyst is a tendon cyst, so it arises from the tendon sheath. In this case, the tendon sheath of the semimembranosus tendon. A semimembranosus cyst is usually located slightly more medial than a Baker cyst, and it is also more painful. The diagnosis also here is made by ultrasound, or even more accurately, by MRI. For the treatment, injection therapy, physiotherapy, and temporary anti-inflammatory medication can be sufficient for smaller cysts. But if the cyst is larger and causes a lot of discomfort or pain, surgical excision of the cyst is the only option. 3. Fabella syndrome. A fabella is an extra bone that is present in about 30% of the population and which can be a source of pain because of local irritation. When present, it is always located on the lateral side in the head of the lateral gastrocnemius muscle, so the pain spot is very typical. The diagnosis is easily confirmed with an MRI or ultrasound. The treatment consists of local injection therapy with anti-inflammatory medication combined with physiotherapy, and usually this is sufficient to heal the inflammation. In more severe or recurrent cases, surgical excision of the fabella is sometimes required. In some cases, the fabella is more fibrous than osseous, and then the diagnosis is more difficult and can be missed. The treatment is, however, exactly the same as for an osseous fabella. 4. Popliteus tendinitis. In popliteus tendinitis, the popliteus tendon is inflamed, usually because of overloading the knee. It is a relatively frequent problem that is easily overlooked. The pain is, obviously, located over the popliteus tendon, which courses also on the lateral side in the back of the knee, but now slightly more downwards and medially compared to a Fabella syndrome. The treatment consists of relative rest with avoidance of the pain-provoking activities, temporary anti-inflammatory medication, physiotherapy, and in persistent cases, local injection therapy. 5. Gastrocnemius tendinitis. In gastrocnemius tendinitis, there is inflammation at the insertion of the gastrocnemius muscle, either on the medial head or on the lateral head, or both. The pain is located somewhat higher up than in the previous conditions. Also here, this is a relatively common condition that is easily overlooked. Especially runners or athletes who use their calf muscles a lot are prone to this injury. The treatment is temporary avoidance of the pain-provoking activities combined with physiotherapy and anti-inflammatory medication for a couple of days. Injection therapy is usually not needed. Important to realize, it may take several weeks or even months before the inflammation settles, even with appropriate treatment. 6. Cruciate ligament ganglion cyst or mucoid infiltration. A cruciate ligament ganglion cyst is a sac of encapsulated fluid around the anterior or posterior cruciate ligament, which shouldn't be there. Mucoid infiltration is somewhat similar, but there the fluid is more slimy or mucus and is located not adjacent but inside the cruciate ligament. Both have the same effect. They cause deep internal knee pain irradiating to the back of the knee. And, very typically, the pain is especially pronounced when the knee is brought in deep flexion, for example as during squatting. The diagnosis is easily confirmed with MRI, and the treatment consists of keyhole surgery with removal of the cyst or thinning out of the thickened fibers. Medication, injection therapy or physiotherapy unfortunately do not help here. 7. Biceps tendinitis. In biceps tendinitis, the pain is located on the far lateral side, over the biceps tendon. It is usually the consequence of overloading, especially of the hamstrings, as during running or cycling. The diagnosis is by ultrasound, and the treatment consists of avoiding all pain-provoking activities, together with anti-inflammatory measures and physiotherapy. 8. Deep vein thrombosis or DVT. In deep vein thrombosis, there is clot formation, thrombus, in the deep veins of the leg, in this case at the level of the knee. This is a potentially dangerous situation because parts of the clot can be released towards the lungs, which we call pulmonary embolism, and this is potentially life-threatening. Deep vein thrombosis typically develops after injury and a period of rest because, due to the lack of movement and the absence of muscle pump function, the blood circulation of the limb is then considerably slower. Clot formation can then easily occur. Usually there is a nagging pain or tension in the back of the knee and irradiating to the calf, like a cramp that won't go away. Sometimes there is also swelling of the leg. The diagnosis is confirmed with a duplex ultrasound and a D-dimer blood test, and the treatment consists of blood thinning medication combined with compressive stockings. 9. Meniscus posterior horn tear or degeneration. A tear in the posterior part of the meniscus may be a potential cause for pain in the back of the knee. Usually there is, however, also pain on the medial or lateral side, depending on whether the tear is in the medial or lateral meniscus. The diagnosis is made by performing the meniscus tests. If you want to know how to execute this, please have a look at this short video. An MRI scan will confirm the diagnosis. The treatment depends on whether the tear is stable or not. If stable, physiotherapy combined with strengthening exercises will suffice. If unstable, arthroscopic surgery may be needed. 10. Posterior synovitis. In posterior synovitis, there is inflammation of the synovial layer, that is the inner layer of the capsule in the back of the knee. Usually, it is caused by overloading the knee. The pain can be located either posteromedially, posterolaterally, centrally, or combined. The diagnosis is made by MRI, and the treatment is simple: relative rest combined with anti-inflammatory measures using physiotherapy or anti-inflammatory medication if needed. So with this, we have covered the 10 most frequent reasons for pain in the back of the knee and what you can do about it. Remember, this information is just a guidance for you as a patient, so that you have some background information for when you see your doctor for the diagnosis and treatment plan. Thank you for watching.